Welcome to Healthline. I am Sheila Whitke, your host. Today, my guest is Dr. Clyde Mathison, an otolaryngologist, a physician who specializes in disorders of the ear, nose, and throat. And today, Dr. Mathison and I will discuss sinusitis treatment using balloon sinuplasty, which is a surgical procedure for the treatment of blocked sinuses. Welcome to Healthline, Dr. Mathison.
Thank you, Sheila.
Oh, it's nice to have you as my guest
Thank
today. Sinusitis affects 37 million people each year, making it one of the most common health problems in the United States. This is about 14% of the adult population in the United States. Also, sinusitis affects 17% of women and 10% of men each year. Direct health care expenditures due to sinusitis costs are well over $8 billion each year. Now, in order to understand sinusitis, it is important to first learn about our sinuses and their role in our health. And today I want to begin by discussing the sinuses, and then we will discuss sinusitis and its treatment. And Dr. Mathison, will you describe the sinuses and their location, and then also explain the purpose of them in the body?
The sinuses are four air-filled spaces that are located around the nose. There's four paired ones: the frontal sinuses here in the forehead, the maxillary sinuses here in the cheek. You have your ethmoid sinuses, which are in between your eyes, and your sphenoid sinuses, which are basically right in the middle of your head. And they have various functions. Their job is to help warm, filter, and humidify the air as you breathe it in through the nose. They act to make the head lighter. There's some role in trauma and basically as a crumple zone for the face. But those are the main roles of the sinuses.
Okay, good. Thank you. What basically is sinusitis itself, and what causes it?
The sinusitis is inflammation of one or all of these four paired spaces around the nose. What causes it? It can be various factors. The inflammation itself is caused by blockage. It's what caused the blockage is the real question, and that could be allergies, environmental toxins, smoke, pollutants, viral infection, bacterial infection, physical obstruction, either from trauma or perhaps a tumor.
Okay. Basically, what are the signs and the symptoms of sinusitis?
Patients will typically complain of facial pain, facial pressure, headache. You may even have mild change in vision, difficulty breathing through the nose, inability to smell, inability to taste, drainage from the nose. It could be discolored, thick, yellow, green, various colors. It could be clear. Headache is usually the big one. Patients usually complain of pain and pressure here in the cheeks, up here in the forehead.
Okay, good. Thank you. Now, there are two types of sinusitis, and there's the acute form and then there's the chronic form. And doctor, will you describe the acute and also the chronic sinusitis and explain how long each type usually lasts?
So acute sinusitis is that typical infection that most adults get once or twice a year. It lasts anywhere from 1 or 2 days all the way up to 1 or 2 weeks. Patients will have those symptoms that I mentioned a few minutes ago with facial pain, pressure, difficulty breathing. But once it gets beyond the few weeks, then we start getting out of the acute phase and we start heading towards the chronic phase. And to meet the definition of chronic sinusitis, you need to be sick for 3 months, so 90 days.
Wow, and I do know some individuals that it seems like that they have it, they get better for a few days, and then it starts all over again.
Yes, there is a classification of sinusitis called RARS, recurring acute rhinosinusitis syndrome.
Interesting.
Very similar to what you just mentioned. Those patients, they get sick, their headaches, drainage, can't breathe, and that lasts about a week, maybe 2 weeks. Then they get better for a couple weeks. Then they get sick again. Then they get better again. And they keep doing this flip-flop thing where they go sick to better to sick to better. And technically they don't meet the criteria for chronic sinusitis. You have to be sick with symptoms for 90 days. But the RARS patients, they still have decreased quality of life. They still have problems in terms of continued symptoms, and they need help.
And so it's like a recurring acute phase then.
Correct. Correct.
That must be frustrating to those
Very
individuals.
very much for those patients.
Yes, yeah.
Because they think they got it beat, and then it comes right back.
Yes, yes. What are the tests, assay, and methods that you use to diagnose sinusitis?
Usually it's history and physical exam.
Is it?
You talk to the patient.
How long they've been
How
sick?
long you've been sick, what sort of symptoms are you having, and then on physical examination we'll look in the nose, either with a small little flashlight that we have, or we also have various endoscopy techniques, little scopes and cameras that we can use.
Mm-hmm.
And we're looking for swelling, we're looking for blockage, we're looking for drainage. Sometimes patients may develop polyps in their nose, and we're looking for those type things.
Okay, good. Thank you. Chronic sinusitis can, excuse me, make an individual miserable and impact his or her quality of life, as Dr. Mathison just said. In order to get relief, the right treatment must be chosen, and sinusitis is typically treated first with medication and nasal sprays. And Dr. Mathison, will you discuss the medical therapies what used as the first line of treatment for sinusitis and basically their effectiveness?
First line treatment is it's not always, but usually it's over-the-counter medicines first.
Okay.
Excuse me. Nasal steroid sprays are a mainstay. There are several that are now over-the-counter. They used to be all prescription only, but several over-the-counter. They can be picked up at any major drugstore.
Good.
Mucolytics such as Mucinex or guaifenesin. Pain control, fever-reducing agents, Tylenol, Advil, Motrin, etc. Sudafed can help. Nasal saline irrigations can help. That's usually the first line treatment. And then once a patient has been sick for approximately 7 days, that's the current guidelines, then we start to have the discussion, all right, do we need to add antibiotics to this?
Okay.
Studies have shown that if a patient is sick for less than 7 days, it's almost always viral, and antibiotics do not work on viral infections.
Good point.
So other medicines, again, the nasal steroid sprays, saline irrigations. In bad cases, we can prescribe oral steroids. But once the patient gets to about 7 days, then we start having the discussion about adding antibiotics to it.
Yeah. And then those are usually given for another week or so?
Yes. For sinusitis, it's usually at a minimum 7 days antibiotic course. Most physicians, myself included, tend to err more towards a longer duration, 10 days, 14 days. Of course, it's always important that the patient finish their antibiotic course that they are prescribed, even if they're feeling great.
Now, you mentioned one of the things, too, when you were talking about medical therapies, mucolytics. Would you explain to our viewers what you mean by that?
So I guess the
Just
gold standard one is Mucinex. That's the one you can find at all the drugstores across Knoxville. It helps to thin the thick secretions, the
gunk.
Gunk, perfect word for it. The thick gunk that's in the nose. It helps thin it out and helps it all drain out. And that's the whole point, is to get all this stuff that's backed up out.
Yes.
The antibiotics reduce the infection. Steroids, nasal steroid sprays reduce swelling to help open up the passageways. Sudafed does that as well to help everything flow.
Good. Super. Good explanation. At least 20% of individuals do not respond adequately to medications, and these individuals may be candidates for two types of surgery. They are the traditional endoscopic sinus surgery, or ESS, which has been around for a while, and another procedure, the balloon sinuplasty, which we're going to talk about today, which was just approved in 2005. And Dr. Mathison, will you discuss the balloon sinuplasty procedure in just a minute, but first would you describe the traditional endoscopic procedure, or ESS, sinus procedure, and the instruments that you use, and then also the risks that may be involved with this type of procedure.
Endoscopic sinus surgery is, in its current form, has been around since about the mid-'80s to late '80s. We use small little cameras and scopes to look in the nose, find the openings to the sinuses which are blocked, and make them bigger. That's kind of the goal, to allow everything, again, to drain out. The instruments that we use, various biters and grabbers. I mean, that's about the best way of putting it. We are removing tissue, we are removing bone to get everything more open. Again, that's the goal here, to get everything open, to allow everything to drain out. With the sinuses, slight variations in instruments depending on which sinus it is, but again, biters and grabbers, get the bone, get the tissue, open the door to allow everything out. Now, the patients that are candidates for this, you mentioned that earlier, is those patients that have been through several rounds of antibiotics. It's not just 1 week course of antibiotics and then you need surgery. No, you need several rounds of antibiotics. You need to be on a nasal steroid spray. Unless there's a medical contraindication, and we'll give oral steroids as well. These patients who we're having the discussion about possible sinus surgery need to have their allergies worked up. Allergies and sinusitis come hand in hand.
That's true.
And most patients who have bad sinuses typically have bad allergies, and vice versa. So once the patient's been worked up appropriately, we have tried everything that we can medically, trying to avoid surgery if we can, and that's when we start having the discussion about surgery.
I'm going to put you on the spot, but basically, what sinus area is the most common that you see with infection? Is it usually in the ethmoid or in the maxillary?
Probably the ethmoid and maxillary.
Okay, those seem to be the most common. Or, of course, cheeks and between the eyes.
Yes, cheeks in between the eyes.
Yeah, okay. Now, will you describe the balloon sinuplasty procedure and the instruments and devices used with that, and then explain how it works?
So the balloon device is very, very different. It's minimally invasive. That's the big difference between the two. It's very similar to angioplasty, all right, in which in angioplasty, the cardiologist, the heart doctor, feeds a little wire into the blocked vessel of the heart, and then feeds a balloon over that wire and dilates the heart blocked vessel open to allow blood flow to keep going. And this is very similar in that we use a little device that gets a wire into the sinuses. The balloon goes over that wire and then dilates the sinus. So there's no bone removal. There's no tissue removal. That's the big difference here. It's bone remodeling. Everything is pushed to the side rather than
just
cut
kind of
out.
Stretching.
Exactly. Exactly.
Excuse me, what type of anesthesia do you use with this? And then how long does this procedure usually take when they do it?
It's under the local anesthesia.
Oh,
so
okay.
It's done in the office. We use some pretty strong numbing medicine so the patient is comfortable. I will give most patients a medicine that helps relax them a little bit.
Okay.
So they're not as anxious during the procedure.
Right.
All in all, it takes the actual procedure itself 15, 20 minutes.
Oh, that's great.
That's it. Now that's time that I'm...
Of course, there's preparation for
exactly,
you, the surgeon.
Exactly. So, I mean, there's time where the patient's sitting in the office and they're numbing up and they're kind of talking with their family and wasting time until the numbing medicine really kicks in. Now, if you throw that in there, you're looking at about an hour.
Okay.
So about 30 minutes of numb up time and about 20, 30 minutes of actual procedure time.
Now, are these, the balloon and stuff, are the material that you use, are they safe and are they non-hypergenic, like the non-latex and stuff like that?
Correct, correct. No latex at all.
Okay, so if they have any allergies, there wouldn't be any problem with that.
No, yeah, exactly. Yeah. No issues whatsoever with that.
Okay. Basically, what are the risks with this type of procedure, the balloon?
The risks are the same as with ESS or endoscopic sinus surgery, though the percentage, the chance is much, much less.
With this?
So bad nosebleed.
Because basically it's just stretching again?
Correct. Bad nosebleed.
Oh, really?
That's always a possibility. The nose has lots of blood vessels in it.
Sure.
And
yeah.
It likes
Even
to bleed.
Even when we blow our nose sometimes.
Correct. Bad nosebleed is one. Scar tissue forming inside the nose. That's a big problem with regular ESS in terms of scar bands forming that can actually block off the opening that the surgeon just created. Correct. Yeah. There's a lot more healing involved with ESS than there is with the balloon sinuplasty. Okay. You could have change in vision or double vision afterwards.
Because, especially if you're working on the ethmoid, or
yes,
why?
And it's just because of the proximity
Oh, I see.
to the optic nerve and the proximity to the actual eye globe itself.
Okay.
To my knowledge, it's never been reported with balloon sinuplasty.
That's wonderful. That's good.
Never been reported, and it's exceedingly rare with regular endoscopic sinus surgery. Other complications, you could have what's called a CSF leak. Now, CSF is basically brain fluid. It's the fluid that surrounds our brain, that cushions it. And the top of the sinuses is the bottom of the brain cavity. And if the surgeon gets a little aggressive and pokes up too high, brain fluid comes out.
Okay.
So that has been reported with balloon sinuplasty. I've heard of it only occurring once, though.
That's good. So it's rare.
And, yeah, very, very rare. And I think there were several 100,000 balloon procedures performed in 2015 alone. So the odds are extremely, extremely remote. With regular sinus surgery, it is it's more common, but still very, very, very rare.
Yeah. Okay. Good. That's good to know.
Another risk would be the need for a revision procedure.
Now, what do you mean by that?
Needing additional sinus surgery, whether additional
in a different area or in the same area?
In the same area sometime in the future.
Oh, why is that?
It could be from scar tissue forming, like I mentioned.
Sure.
It could be from continued infection that just never cleared. Poor surgical technique. Hopefully that's not the answer.
That's true.
Or the cause. Those are the big ones.
Okay.
Generally, it is due to continued infection.
Oh,
Is
sure.
what it is that the surgeon gets the door open, either via biters and cutters, removing bone and tissue, or dilates the opening. But the sinuses don't really figure it out. They don't drain. Sometimes that stuff, that gunk, as you put it, just sits there.
Oh, okay.
And it never clears like it's supposed to.
And then creates an infection.
Correct. And then leads
so
to more
then-
blockage, which
Okay.
leads to more infection,
Oh,
which
yeah.
leads to more symptoms.
So
and
it's
it
a
just-
vicious circle.
It's a vicious circle.
Yeah. Oh, my
So.
goodness. Yeah. Okay. How do the sinuses openings, how do they stay open with the balloon sinuplasty?
Well, the
'Cause
balloon
basically all you're doing is stretching.
is
that area.
stretching. That's true. Now, there is bone in there, and it's very thin bone. And the balloon actually breaks this bone.
Oh, it does.
It does break the
Because
bone.
it's pushing against
It's
it.
pushing on it. The balloon has 12 atmospheres of pressure in it.
Ooh, that's quite a
That's
bit.
several times more than what's in your car tire.